Before we get started, let's begin with a simple breathing exercise.
Other than being easy, belly breathing is a relaxing exercise that can help you relieve stress.
Step 1. Sit comfortably on your chair without slouching. Step 2. Put one hand on your belly just below your ribs and one hand on your chest.
Step 3. Take a deep breath through your nose. Let your belly pull your hand in. Make sure that you don't move your chest.
Step 4. Breathe out through pursed lips as if you were whistling. Feel the hand on your belly go out and use it to push all the air out.
And lastly, step 5. Do this breathing exercise 3 to 10 times. Take your time with each breath. Have you ever felt difficulty in breathing or shortness of breath after a good workout, or maybe just from climbing up the stairs? These signs are normal, and we experience them in our day-to-day life.
Although these signs are normal, we must be able to tell whether these signs are merely the result of our daily routines or symptoms of respiratory diseases.
Whether these signs are normal or not, here are 6 common symptoms of respiratory diseases.
Number 1. Difficulty in breathing. This symptom is very familiar to everyone, for we experience this whenever we exert ourselves. However, prolonged difficulty in breathing when you are not doing anything can be a symptom of a respiratory problem.
Number 2. Stubborn cough. Coughing can be the result of many possible reasons. Nevertheless, it can be easily treated with medicine. However, when your cough has not subsided after taking medicine, it is considered chronic.
Number 3. Breathing noisily. Obstruction of the airways can be the reason for this symptom. It is advised to go to the doctor as soon as this symptom emerges. This is also a common symptom of asthma.
Number 4. Lingering chest pain. Whenever you are experiencing sudden or severe chest pain, it is highly recommended to go see a doctor immediately or to the ER. This symptom is not just a sign of respiratory problem but can also be a sign of cardiovascular disease.
Number 5. Chronic mucus. Production of mucus is essential in our body's defense mechanism. However, if you have been coughing up phlegm along with the feeling of drainage in your chest, it is important to let your doctor know right away.
And lastly, number 6. Coughing up blood. The blood that escapes with cough may come from the lungs or to the respiratory tract. It is important to know that this is not normal and medical care must be sought immediately.
These symptoms are mainly caused by infection, smoking and/or secondhand smoke, exposure to radon, exposure to asbestos, and other forms of air pollution.
Inhalation of radon is the second leading cause of lung cancer. Radioactive particles of radon which decays easily can damage the cells that line the lung. Although not conclusive, radon exposure may increase the risk of leukemia in adults and children.
Significant exposure to asbestos fiber may lead to asbestos-related lung disease. Asbestos fibers are small and if inhaled, it can get stuck deep in the lungs. The fibers may remain in your lung tissues, which will eventually lead to scarring and inflammation.
Respiratory diseases is one of the leading causes of mortality in the Philippines. 4 out of 10 deaths are caused by respiratory disease. If prolonged, the 6 common symptoms may lead to the top 3 lung diseases in the Philippines.
Lung cancer. Lung cancer is the leading cause of cancer deaths in the United States. Not only is it common for smokers, but it is also common for people who are exposed to secondhand smoke. Smoking causes cancer by damaging the cells that line the lungs. If exposed to prolonged smoking, these cells will act abnormally and eventually develop into cancer. Because cigarette smoke contains carcinogens, changes in the lung tissue begins almost immediately.
Asthma. Asthma is a chronic disease which is caused by the inflammation of airway passageways. This causes the passages where oxygen travels to narrow. This results in wheezing, coughing, shortness of breath, and chest tightness.
Pneumonia. Pneumonia is an infection in one or both lungs which is caused by bacteria, virus, or fungi. It causes inflammation of the alveoli or air sacs because pus fills up the alveoli, causing the patient to have difficulty in breathing.
Now that you know the common symptoms and causes of respiratory diseases, it is important to know how to prevent these symptoms from occurring. Some preventive measures you can do are:
Do not smoke.
watch out for indoor pollutants such as secondhand smoke and exposure to radon.
Minimize exposure to outdoor pollutants. Wear a face mask if necessary.
Be hygienic to prevent infection.
Exercise.
And attend regular healthcare checkups.
The following information will help the prevention of respiratory diseases and will inform you of the causes of it. With these, we will be able to maintain good health throughout our lives. Remember, prevention is better than cure.
And remember, breathe deeply and be happy.
Hey, 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 respiratory